Hello, boys and girls. Today we will be discussing the signs and symptoms that come with mental health disorders. Understanding the importance of breaking the stigma and making sure that we are, recognizing these signs and symptoms so you can help, whether it be yourself or a family member or a close friend. And important to realize that, these mental health disorders are happening so much more frequently than they were, a couple years ago and even 20, 25 years ago. Um, Overall, 1 in 4 people will be diagnosed with a mental health disorder every single year. Um, that increases to 1 in 2 when you have somebody who is an adult that is in debt, or is somebody that is, struggling financially. That can change to 1 in 2. So 50% of those people can suffer from a mental health disorder as well. In the last 25 years, mental health has risen from to 70% in teens with anxiety and depression and things like that we're increasing the risk by 70%. So that's a really high number to think about. Kids that are your age or in the next couple years can be suffering from these disorders. 70%. It's also important to realize that mental health disorders can go from an entire range of, people who have worries with, normal everyday school friends, worries that we'll have every single day, to somebody who has severe depression, somebody who has completely lost touch of what is going on in the world and the reality of the world. So there's ranges from, very, very minor, or being able to handle them within just talking to somebody, or, somebody who needs medicine or maybe counseling, therapy, and then those who, need to have a psychiatric help on a regular basis to be able to, focus and stay where they're supposed to be. So by showing this, we're going to hopefully try to break the stigma. We're going to hopefully try and, educate ourselves so that we are more aware and we can be more understanding to those who may or may not, suffer or know that they're suffering yet. So we're going to discuss a few different disorders, and then hopefully we'll be able to make a change in the world. So the first one that we're going to be discussing is anxiety. We all have stress. We all have things like work or home or school that are going to stress us out. But for some people, and those who have anxiety, will have it for a longer period of time. It's going to make it really hard for them to, carry out a simple task. It could be a panic attack. It could be, somebody who has a really hard time memorizing or concentrating on things. It can be somebody who is having difficulty making decisions. There's so many different disorders and ways that we can, help somebody or notice what is going on. Somebody who's getting angry at you for no reason, or, tries to get away from, certain situations. It could be because they're having, an anxiety attack, or it could be that they are stressed because of something that is out of their control. So one of the things that you want to look at, or one of the things that you want to be more understanding about, is helping somebody who doesn't have the ability to really make sure or to understand what is going on with their own mind and their own body and how they're handling things. Depression's another one that we'll talk about. Most of us have had highs or lows, good days, bad days. I always say, what was your high of the day? What was your low of the day? But for some people, that low, that sadness doesn't go away. Somebody who is depressed can feel anxious. They can feel sad, guilty, angry, sometimes helpless or hopeless, and they have no control over, making themselves feel better. They may have low self-esteem, only see the negatives. You want to make sure that you're looking for somebody who's constantly criticizing themselves or blaming themselves. They're forgetful, or they don't realize or hear things about, what, they may not want to remember certain things or certain times that are more positive than others. They may, not always clean up after themselves, or they may, not want to take responsibility. They may have stopped caring about what they look like, so their hygiene or their appearance can also suffer as well. So definitely signs or symptoms to look for. Bipolar disorder is going to be a severe mood disorder, which can cause a fluctuation in your personalities. So, really good days and then really bad days. They can have a hard time holding relationships or jobs because they don't know what kind of personality or what kind of mood they're going to be in. It might be really hard for them to no longer be able to hold on to, like, 1 minute they're really like holding on to a conversation, 1 minute they're really happy and over with more energy and things of that sort, and then the next minute they're easily distracted, or they're not focused in on what you guys were talking about. There may be a lack of overall energy. Maybe there's a high in energy, and then all of a sudden it's a low in their energy. So somebody who is constantly switching back and forth, and it might appear like they don't have control over their highs or their lows, or they may not be able to be aware when their personality or their mood changes because it's not in their control. The third one that we're going to talk about is schizophrenia. So for schizophrenia, this is widely misunderstood because so many people think that it's, having split personalities or, being different like people. And really what happens is somebody that has schizophrenia is going to be more of somebody who can't control what's going on inside their head, as in, like, they may hear voices, they may be talking to you, or all of a sudden then they're distracted because they're hearing something else going on in their head, or they may be talking to somebody who isn't really there, or they may have a conversation within themselves, and it can be really hard for them to hold jobs or conversations. It may be really hard for them to be able to talk to somebody for a long period of time without getting those mood changes or getting those other conversations. The last one that we're going to discuss is OCD, obsessive compulsive disorder. So one of the real common signs of somebody who has OCD is going to be constantly like touching things over and over again. They get obsessed over one fact, or they may fixate on one tool. So maybe they feel like they're really, dirty, or there's germs, or they can like feel like they see things. So they're constantly washing their hands, or they're constantly, cleaning a certain area. You're going to see that they're going to not, they're going to lead, like, it's going to lead them to do things over and over again, more than it would on a normal person. The compulsive disorder would be like making sure that your door's closed and double checking or triple checking that you are locking the door, and making sure that they fix it again and check one more time, or they didn't leave yet, so they have to check it again. So those repeated actions are also definitely something that you'll see. They may get fixated on a number. They have to do something 3 times. Every single time it's 3 times. And that can also have an effect of them not being able to hold a friendship or a relationship, because it can be confusing, or it can be, distracting to the other people, and they may think that it's weird. So when we're talking about all of these disorders, and there's so many more that we could discuss, but when we are discussing these ones specifically, and any mental disorder, it's so important to realize that we have resources, not only just at school, but at home, a trusted adult, somebody that you care about, or know that they care about you, is somebody that you can talk to. Teachers, social workers, guidance counselors, anybody that's a trusted adult at school. And then if it gets to that point and you want to go to a, therapist, or, a doctor, even, somebody that you can start with. So just making sure that you have the resources, you have the people that care about you, because you all are so important. All right. So if you have any questions, I am always somebody that you can talk to, and just know that there are so many people that are here for you, and so many people that want the best for you. Thank you.